it's still things that we're pushing for, making sure that we're able to put more money into the pockets of everyday hardworking Alabama families. So that is the Democrats' vision. That's the Democrats' criterion. That's what we are marching towards and for.
Alrighty, welcome back. Alabama Politics This Week. Josh Moon, David Person, and we are thrilled as always to have with us Representative Neil Rafferty. Neil, it's always great, man, to have a sane person come on with us, and you fall firmly into that category. It's always such a good. We have a lot of folks on, and it's all, the sane people, because before we come on, we have a nice, normal conversation with somebody, and we laugh and joke, and, and it's just an easy way to do things. And so we do appreciate you sane people for coming on and spending some time with us and for what you do. And, I know we really just gotten this thing kicked off in the legislature, the 2026 session. But we are, we're making some headway. And, I noticed last Saturday, there was a race in Texas, in which a union member, first-time candidate for state senate, flipped a +17 Trump district to a +15 Democratic victory, and did so pretty much entirely on the issue of affordability, addressing issues that really matter and are really keeping the average person up at night. So I know this is also, I've spoken with Anthony Daniels and some other folks. I know this is going to be a major issue, and so we wanted to talk to you about it. What do y'all see? What is kind of the agenda going forward? I know you're going to have a press conference. We record this on Wednesday mornings. I know there's going to be a press conference Wednesday afternoon that touches on some of the affordability issues. What is kind of the agenda for the Democrats?
I mean, the thing is that real Alabamians are hurting, right? So as you say, and these are the issues that keep people up at night. I think Democrats are really trying to hone in and focus on the issues that matter the most to the people that put us in office. We focus on affordability. Last year we were able to get the package through that dealt with baby products and diapers, and it's removing the tax off of menstrual hygiene products and that kind of thing. Push forward with the grocery tax as well. And, the Democrats have been pushing for the overtime tax as well. That got repealed last, I think that went out of effect or sunsetted back in July, last July. But, it's still things that we're pushing for, making sure that we're able to put more money into the pockets of everyday hardworking Alabama families. So that is the Democrats' vision. That's the Democrats' criterion. That's what we are marching towards and for. So,
I think a lot of times, people will say, we know what, we need to focus on affordability. And we need to really get in there and save people some money and stuff. But that's nice to say. But there, as somebody will say, the devil's in the details.
Of course, times. Absolutely.
And there's some, it's not always easy to address the things that are really costing people money sometimes. Sometimes these are things that have been years in the making, and sometimes it's just hard to actually get in and carve out a way to save people. But so when you look at it right now, what do you feel like are the most pressing things that can be done? Or what do you feel like the most pressing thing is, or the easiest thing to attack right now?
Well, I think right now we're hearing a lot about healthcare expenses as well as energy bills. And I think those are two things that we need to be hitting on directly and face forward. So Healthcare costs are skyrocketing. The big beautiful bill is a big beautiful disaster, and I think we're starting to see these premiums go up because of all the cuts that they did to Medicaid and other essential programs that the state of Alabama and the people of Alabama depend on. And it doesn't just affect the Medicaid recipient; it affects all people because you take that block of healthcare coverage away or lessen the amount of coverage there, everyone else's premiums have to go up to kind of make up for it. So we're starting to see that happen now in real time, and people are starting to feel that in their pockets when they go to the doctor's office. I think energy bills is another thing. I think there's been a lot of discussion on this so far as how high Alabamians on average are paying for their electricity. I think we're going to be making some headway on that too this session.
You mentioned healthcare, Neil. And I know one of the Republican counterpoints to that has been this huge package that is supposed to be in the big, beautiful bill related to rural health care. And it suggested that, I think it's several $100 million or something like that. And it suggested that each state is supposed to be getting, if I'm not mistaken. And so it is said, I know Senator Britt and others have touted that as a possible solution to the rising healthcare costs in Alabama. What do you say to that?
My first question would be, is it sustainable? As you've already said, the devil's in the details. So what does that mean? What does this rural healthcare package look like? Is it like? Is it insurance coverage for folks? Is it supposed to be money to kind of come and fill in the holes for the hospitals that are having to really lay off staff and shortcut everything and make sure that their hospitals are lean as they can be to even stay open and keep the lights on? I would have a lot of questions as far as what that looks like and what it will be. At the end of the day, Alabama still has an expanded Medicaid, and we're losing a lot of money, a huge bucket of money from that. So I'm curious to see what that package would look like, and how it would actually work. So.
What do your Republican colleagues say about, in response to the Democratic assertion that expanding Medicare wouldn't just be a safety net for hospitals and for patients, but would actually create jobs? I mean, they're supposedly so big on job creation. What do they say when that point is presented? What's their response? What's their retort?
Well, I've heard myriad things, but I've heard that what happens if we get dependent on this money. That's kind of usually what you hear around that. The thing is that Trump promised in one of his first speeches that he would come up with a comprehensive healthcare plan to lower the cost of prescription drugs and healthcare for all Americans. And we have yet to see that plan, and we have yet to see any of that. The only effect that we've seen here in Alabama is people losing coverage and people who do have coverage getting more expensive.
He has concepts of a plan.
Right,
That's coming any day now.
Right.
Well, so I would love to see what those concepts were and what that solution actually looks like. So, you hear plenty of different things. It's not our job and responsibility to do these kinds of things when we are actually the administrator. The state is the administrator of Medicaid, as well as other sorts of mental health services, substance abuse services, and schools, for instance.
Yeah. No, you're right.
Let me ask you,
the concepts of it is just ridiculous. I mean, they never come up with anything. They never come up with anything.
Yeah. Let me ask you. Let me shift directions on you, Neil. Let me ask you a political question. I know we're talking about affordability, but I want to ask you a political question as my final question to you.
Okay.
So, there's a lot of internal infighting going on right now, not just in the National Republican Party, but in the state party, the state Republican Party.
Right.
Tuberville's being challenged by McFeeters. People are challenging John Wall on also in terms of whether or not his candidacy really is legit or not. And so I wonder what you're seeing on the ground level as an active politician and elected official on the Democratic side. Are you sensing perhaps that maybe there's some cracks in the wall of the Alabama Republican Party that Democrats can take advantage of?
Well, so I mean, one thing I certainly see is, I think there are some folks that do want to focus on real issues and some folks that want to focus on ideological issues and red meat issues as opposed to focusing on the real things that everyday Alabamians care about. We're seeing the Gulf of America kind of stuff take over, this kind of blaming and demagoguery that we're seeing on LGBTQ folks and that kind of thing. Seeing kind of like, look over here while I'm doing this over here with your right hand. And I think that there might be some fraction, because I think there's some folks that want good policy and good governance as opposed to ideological governance and ideological policy. So, as far as that Republican stuff, I don't really I try not to get too much in the middle of their kind of affairs, but I do think that there is a good point to tell, the people of Alabama that the Democrats are definitely united in fighting for them, not for these kind of high national issues that have somehow taken charge in the culture sphere. Instead, focus more on the ground issues that people are having to worry about, stay up all night thinking about how they're going to pay the bills and how we can assist and help develop better policy to put more money in the pockets of working American Alabama families. So,
yeah, one of the things, and you mentioned it earlier, was the energy costs and the high prices that people pay, and so I get irritated with people sometimes because obviously that's a big issue. It's a real big issue. But a lot of times it seems that the anger is directed at the wrong people, in my opinion, because the energy companies in this state, the folks who are providing you power, whether whoever it may be, wherever your bill comes from, those folks are regulated.
Mm-hmm.
They're regulated. We have an entity in which the people vote to elect the board that controls these places, that could set the prices, that could set how much they can charge, and all of these things. Does it strike you as odd that there's so little attention paid by most people to this regulatory agency and the Public Service Commission, that the people pay so little attention to this, and yet every month a bill comes to their house that directly affects them, and I don't know if there's a disconnect there, because I hear them a lot blame, Alabama Power or Power South or whoever is supplying, the local folks that are supplying it. I hear them blame those folks a lot of times, but I don't hear them blame the people who are actually responsible for regulating this. And so does that disconnect surprise you? And how do you get people to focus on that?
The disconnect does surprise me, but then it also doesn't. I know that before I was really kind of more involved in state level politics. I have always said that the PSC is probably the most important agency that you've never heard of. I think that most people don't know what it is. If you look at the ballot, it's usually down at the very bottom of the ballot, even after all the kind of more local probate judges and that kind of thing that you'll see in your county's ballot. So it's usually just not high up there. I think a lot of people don't know what they do or how they operate or how they're kind of what they're kind of charged and tasked with either. I think that has been a problem, and I think that more people need to know about it, what the PSC does and how they actually regulate rates, as you will, here in this state.
Yeah, they were able to flip those seats over in Georgia.
Mm-hmm.
And the Republicans have whined about it because, it's environmental money, or whatever. I mean, but honestly, that wasn't environmental money. It was just really the money that was spent there was money to just educate people on exactly what we're talking about. Was
on what the PSC is. Right.
Yeah, right. I mean, it's just listen, to expect a company to not try to make as much money as possible is insanity. That's what they're going to do. It's just what they're going to do. And so you're getting mad it's like getting mad at the dog for biting. I mean, it's that's what the dog is trained to do. And so it just I don't know. It has always bothered me that we've gone to this extreme, and it's kind of the on healthcare stuff. What does it not seem like that we're just continuing to apply lipstick to the pig when it comes to healthcare, and we all know that the only solution to this is a socialized medicine. I mean, you know what I'm saying? Is it? We keep coming up with this way to save a little bit of money and this way to save a little bit of money, and at the end of the day, we know, anybody with any rational thought knows that whatever we choose is unsustainable, right?
Well, I think there's even a bigger issue kind of at play here, and that deals with the cost of pharmaceuticals and skyrocketing costs that we're seeing there, as well as the workforce element and criteria there too. I think you can have a system in place to pay for healthcare, but if it's not compensating the people with the training to provide these healthcare services enough, then I think we're going to be in the same boat where people are going to go to other states or somewhere else where they can at least support themselves and their families and pay back, all those student loans that they might have accrued in the years to get that training. So I don't know. There's not. I know that there's been a lot of different discussion and trying to fix and adjust this. Ultimately, I think most people want the most affordable price for their health care to get the most optimal experience or outcome that they can from that healthcare experience, but then also make sure that it's that it's affordable. And I think people want choice. And that's where I think that we need to be focusing on, is making sure that people have an optimal health care at the most affordable price. And right now, the current way it's in, as the Republicans have dismantled Obamacare over the years, I mean, this is years in the making of dismantling a program that very well could have worked well, but it's just been dismantled year after year after year. So,
yeah, that was one of Trump's fix. As one of Trump's fixes to this whole healthcare thing was literally putting back in one of the things out of Obamacare that they took out.
Right.
That was a major accomplishment. Yeah. Look, I broke this. I'm going to put the piece back in to fix it. I mean, it's just, the bar is, God, it must be nice to be a really wealthy white person. I mean,
I wouldn't know,
because the bar is so low, it's so low for accomplishment. But hey, Neil, thank you, man. Thank you for coming on, spending some time with us, and,
absolutely,
and for the work y'all are doing
up
there.
Y'all.
And y'all keep banging away, and I think we'll get this thing turned right. Maybe we can get some break that supermajority here pretty soon.
Maybe we can. Hey, fingers crossed.
All right.
Yeah.
Thanks for having me on, guys.
We really
Y'all take
appreciate
care,
it.
fellas.
All right.
All right. Take care, Neil.
All right. Bye-bye.
That's Neil Rafferty. He is he's one of the good ones, and he is keeping people sane at the State House. It's Alabama Politics This Week. We'll be back in just a minute.